There is an oxygen crisis brewing in the nation. Hospitals are constantly updating with the hours worth of precious oxygen left with them. While on the other hand, you have cases where people are dying owing to a lack in supply of oxygen. The situation is so serious that in the latest, the Supreme Court has pulled up the center and has asked for a national plan over the matter while terming it an emergency. You're watching TV9 Digital. I am Adarsh Vepachedu, and in this video, I will be giving you 9 updates on how the country is battling to breathe. Story number 1. After much uncertainty and SOS calls, Delhi Chief Minister Arvind Kejriwal has confirmed that oxygen has reached the national capital. He thanked the centre and Delhi High Court in ensuring Delhi gets its share of oxygen. He said that as per Delhi government's estimate, the Union Territory needs 700 metric tons per day, and centre had fixed it to 378 tons earlier and increased it to 480 tons yesterday. Kejriwal said that Delhi does not produce oxygen and that it is brought from other states. He also said that oxygen is set to arrive from Odisha and that efforts are being made to see if the oxygen can be brought via air. Story number 2. However, there were some tense moments last night. Oxygen support had almost come to an end at the Rathi Hospital in Delhi. Hospital authorities were in a helpless situation before the hospital received oxygen cylinders shortly. In another overnight update, 2 batches of 21 oxygen cylinders each were supplied to Mata Chanan Devi Hospital in Delhi. The hospital has 200 COVID-19 patients and oxygen consumption is very high. Story number 3. The Delhi High Court in its late night hearing on a PIL filed by Max Hospital over oxygen shortage pulled up the centre over the prevailing situation. It asked the centre to immediately stop the supply of oxygen for industrial purposes. The Delhi High Court said that it cannot see people dying because of lack of oxygen supply. It asked as to why the government is not waking to reality. The High Court said that the centre must beg, borrow or steal to provide oxygen while terming it a national emergency. Story number 4. A day after an oxygen tanker leaked at Nashik's Zakir Hussain Hospital, leading to the death of 24 COVID-19 patients, Maharashtra Chief Minister Uddhav Thackeray has ordered a high-level probe by a 7-member committee to investigate the incident. Uddhav Thackeray also announced a compensation of 5 lakh rupees each to the kin of the deceased. State Health Minister Rajesh Tope said that the high-level inquiry will ascertain if negligence had caused the tragedy. Story number 5. Union Health Ministry put out details of oxygen allocation to 14 states, which is a total of 10,350 metric tons. Delhi has received a total of 61,900 metric tons of oxygen so far. Gujarat received 1,63,500 metric tons. Maharashtra over 2,69,000 MT. Uttar Pradesh over 1,22,000 MT. Madhya Pradesh over 92,000 MT. Chhattisgarh over 48,000 MT. Kerala over 16,100 MT, Karnataka over 25,000 MT, Haryana over 29,500 MT, among others. Story number 6. To address the exponential spike in demand, the centre has increased the quota of oxygen for Maharashtra, Madhya Pradesh, Haryana, Punjab, Uttar Pradesh, Uttarakhand and Delhi. On your screen is the new allocation versus the old allocation of oxygen. While most states have got an increase in allocation of 25 to 80 metric tons, Delhi has got the highest increase, that of 102 metric tons. Story number 7. After oxygen allocation quota was increased to a few states, Karnataka Chief Minister B.S. Yediyurappa requested the centre to provide 1,500 metric tons of oxygen every day. Karnataka Health and Medical Education Minister Dr. K. Sudhakar expressed hope that the central government will respond positively. On the other hand, State Minister for Mines and Geology Murugesh Nirani instructed steel companies which have been producing liquefied oxygen in their plants for their use in steel production to increase the production and supply them to hospitals in the state on a priority basis. He said the steel companies have extended cooperation and agreed to increase production and supply of oxygen, and that this will help save many patients who are in dire need of oxygen in the ICUs. Story number 8. These are visuals of the Oxygen Express arriving in Visakhapatnam of Andhra Pradesh. The cryogenic tankers, with a total carrying capacity of more than 100 metric tons of LMO or liquid medical oxygen, will be loaded with LMO at Rashtriya Ispat Nigam Limited or RNIL in Visakhapatnam Steel Plant. Story number 9. While states struggle owing to a shortage in oxygen supply, Kerala is an exception. The state not only has surplus oxygen, it is also supplying it to other states. For instance, Kerala sent 20,000 litres of liquid oxygen to Goa amid the widespread shortage due to rapid rise in the number of COVID patients across the country. Nodal officer for oxygen supply in the state said that Kerala is well equipped to handle the COVID situation and that oxygen was being supplied to Tamil Nadu, Karnataka and Lakshadweep as well. So what do you have to say about the kind of oxygen crisis that the country is facing at this point in time? Do share your thoughts in the comment section below. And if you like the content that I've shared with you, make sure you like and share this video. And yes, subscribe to TV9 News on YouTube, Facebook, Instagram and Twitter. Until next time.